So I trust everybody has a copy of the handout. I love small gatherings. I had an opportunity to present in Oregon last month, and it was a little smaller sized group, but it was wonderful because as people asked questions, there were people with different levels of expertise that were able to contribute to the discussion. Got a lot of slides. I'll try to keep an eye on the clock, be respectful of your time, but feel free to interrupt. And if I use an acronym that you haven't heard before, you don't know what it means, stop me, please, and I'll try to be careful about that. Well, my name is Russ Spearman. I'm from Idaho. I work for Idaho State University. I've been with ISU since 2000. To share with you a little bit of my background, I started in this field back in 1981. I worked at Idaho's only public intermediate care facility for people with developmental disabilities back then. And then I ran a day program for adults with mild to moderate disabilities and taught them how to use community resources for about 5 years. Then I went to work for the Governor's Council on Developmental Disabilities, and I worked on staff for about 7 years, and then I served as the executive director under Governor Batt for 2 years. New governor came in, and as you probably all know, they bring sometimes their own people with them. I needed to find other employment, so I went to Medicaid. So I'm very familiar with the state Medicaid program. I actually set up Idaho's 1915C traumatic brain injury Medicaid waiver for the state, and that was back in 1998. As federal money was coming into the states, I was kind of keeping an eye on that. There were grants that were being awarded, and went ahead and went ahead and actually contacted my predecessor, Dr. Beth Stam, who hired me back in 2000. It was only for 2 years. And here we are 19 years later, and we've had 6 consecutive grants in Idaho. I'm real happy about that. This really is the only money that we have in the state is through this federal grant, and I'll talk a little bit more about that. I also have a personal relationship with TBI, in that my daughter was in a car accident her senior year in high school and has experienced anxiety and depression associated with her head injury as well. My family and I shared our home with a gentleman with a developmental disability for 30 years. So I approach this from a very personal as well as a very professional standpoint, and I'm pretty passionate about what I'm doing, and after all these years, I'm one of the older statesmen now, I guess, kind of working in this area. So there's so today, just so people are aware, I know the conference brochure does allude to screening for children. The only children that we've screened are, with parental permission, we've screened a couple of young people, but they were teenagers, 15, 16 years old. So for the most part, our screening efforts have really focused on adults, so I'm going to overview a little bit about the federal program, and then we're going to move right into what Idaho has done around screening. So the Federal Traumatic Brain Injury State Grant Program was created via the Children's Health Act back in 1997. It provides funding to assist states to develop, improve, and expand service delivery for people with a brain injury and their families. Currently, 24 states are funded through May of 2021. There are 10 mentor states, and there are 14 partner states. And we'll talk a little more about that as we go along. These grants help states develop infrastructure and to expand services to underserved and unserved populations. There's the list of states. In the left-hand column, you can see the mentor list. Oregon has been funded, except for the, basically from 2014 through 18, there was a hiccup, and they did not receive funding. But they are a mentor state. Mentor states receive $300,000 a year for 3 years. Partner states receive $150,000 a year for 3 years. So you've got Oregon, and you can see the bolded new partner states as well.
Question?
Yes.
Washington State is neither in mentor or partner category, and since this is a public law, it has to be federal.
It is federally funded,
So
but it
how
is.
come we don't have it in Washington?
Washington, for some reason, has not seen fit to apply for the money.
So who applies?
I think we are
Agent-
this year.
Okay, I heard that. I heard that.
I think in the UW Department of Corrections group is looking to apply.
I think it's, yes, and I heard the same, no, I heard the same thing when I came in this morning. Because when I heard about this back in December, I let Deb know.
Because if it's a Medicaid waiver that you're mentioning, then it has to be through, our CMS and also through our Aging and Long-Term Services Administration,
Okay, so the Medicaid, the waiver, that's separate.
separate. And
This-
this Public Law 15.
So this-
115 is,
This is the Traumatic Brain Injury State Partnership Program, and it is under the Administration for Community Living.
yeah, so.
It's about a $7 million national program. So they can't fund all states, but and there is an RFP, I don't know if it's closed, but there was an RFP after Christmas, because the federal agency received $2 million new dollars in 2016. So they are adding 2 new states, effective June 1 of this year.
Russell, I work with the group that's applying for that grant, and the closing of that grant is just now coming up in the next month. or
Great.
So, and that's at the University of Washington. So they've got a good budget and
Fantastic.
strong proposal, and we've got our.
That's good to hear. That's
How do
really,
we find out, would the TBI council inform us that they have applied for it and how it is going to affect all the communities throughout Washington state?
The group at UW, that when they get authorization for that grant, will notify the council, and the council will let you know.
it's really good to hear.
Yeah.
Really good. Because naturally I'm pulling for every Northwest state.
I'm Susan Jacek. and
Pulling
I
for
work with
Oregon, for
CSER,
Idaho.
Which is part of the University of Washington, sorry.
No, not a problem. Washington, we got to stick together. Any questions? Any more? Okay. Under this last, and this might be helpful, especially for the new proposal. Under this most recent RFP, if you will, from the feds, about 75% of the work that states have to do has been prescribed by the federal government. These are required activities as part of the grant applications. States have to have a statewide TBI advisory board. That advisory board has to consist of at least 50% individuals with a brain injury. Obviously states are going to have family members, caregivers as part of that, but under this new federal agency, they've taken it a little further than actually the Children's Health Act, and they've said 50% people with a TBI. So the other, just so you know, the long-term care ombudsman, which is typically in Idaho, is through the Commission on Aging, as well as an independent living representative, also has to be on that advisory council. Those are 2 new categories. States have to develop or update their annual TBI state plan. If you don't have one, you have to develop one under the 3-year cycle. If you have one, you have to make sure it's been updated. They also put language in the grant proposal that said you have to provide services and supports to people that are on either your traumatic brain injury registry or your trauma registry. There are states that have trauma registries, and there are states that have traumatic brain injury registries, and there are states that have both.
Well, how do you get on the registry?
Yeah.
The registry, it's a hospital registry. So typically, if a person comes through the emergency room and they receive a diagnosis, at the time of the visit, of having a brain injury, then that hospital, based on an ICD, based on a certain classification code, would track that. And then, go ahead, sir.
Could your doctor, assuming you had the correct ICD code, could your doctor submit it if it wasn't identified at a hospital originally? Or you moved to the area?
See, my understanding, there may be different kinds of registries, but this registry in particular has to be someone who has been admitted or has come through the hospital system, a hospital.
But what if they moved there after their injury?
move to,
Move to
Another
that
state.
state after the injury, let's say.
then probably not. There are many people that have had a prior diagnosed brain injury. They would not be captured under this.
Understand, thank you.
Sure.
I just wonder when this took effect, because see, I'm like a 1969 survivor, way back when there was no such thing.
Well, I can speak for Idaho. I will tell you that I suspect registries have only been around for maybe since the mid-90s, mid to early 90s. Idaho passed a trauma registry in 2001. It was never funded. It took us until 2016 to get all hospitals, we have critical access hospitals which are less than 25 beds. We have 26 out of 40 hospitals that are very, very small. It took a long time to get the hospitals to be able to report. So, again, it's a required component. So you can see where the, yes ma'am.
So it would be all hospital in a state like,
All
you
hospitals.
know, I know major trauma is, you know, on the
All.
other side of the mountains, but we have Secretary here, and also critical care hospitals are
Correct.
included too.
Correct, all of them.
So we have the statistical data, which is significant for,
Correct. And I've got to believe Washington State, with the infrastructure that you have in place, that you have a trauma or a TBI registry. I would think so.
I know there's a trauma
We
registry.
don't
Okay.
have- We don't have a TBI list.
Okay. The other allowable activities, and I listed, a state could put on a statewide conference. There was a lot of flexibility. Idaho, under the last grant cycle, began screening people for brain injury because it was a required component. So we've continued our efforts to screen for lifetime history of TBI, and that's what we're going to talk about today. The other thing is, states, there are 9 work groups that were created with the 24 funded states, and states have to participate in at least 3 of the 9 work groups. These are national work groups that involve other states. These are the work groups. So I'm going to read them in case you can't see that. So we've got advisory boards and survivor engagement. Remember I mentioned there were mentor states as well as partner states. Mentor states that have the larger award, they tend to have more infrastructure in place. There's at least one of these states that's leading this, that's leading every work group. So you've got another one on using data to connect people to services, and the mentors are Nebraska and Virginia. Return to learn and return to play. This is criminal and juvenile justice. This is opioid use and mental health concerns. Waivers and trust funds. Underserved populations, transition and employment, and sustainable partnerships. The federal agency came up with these groups as a result of what they've seen since 2015 information that states have submitted. States are required to produce a product. Each one of these work groups has to produce a product as a result of their work. They have quite a bit of discretion. Idaho serves on 3. Our 3 are using data to connect people to services. We are under underserved populations and waivers and trust funds. So those are the 3 that Idaho is on. I mentioned that we've had 6 consecutive grants dating back to 2000. Again, that's redundant. And I'm not going to restate those 2 bullet points, but basically, the money can't be used for direct services. It can be used to develop infrastructure around traumatic brain.
what do you mean by infrastructure?
It could be public policy initiatives. I mean, the luncheon speaker talking about changes to the trust fund in Washington State is a public policy initiative that may actually generate additional revenue for people with a TBI. I've got to believe that. That's huge. Most states have legislation around their trauma registries. Most states have legislation around their Medicaid waivers. Some states have legislation around service arrangement coordination or case management, and the list goes on. There's about 11 building blocks to a TBI delivery system. So we have been doing in Idaho, we had an Ada County commissioner that came to the university and said, we are spending too much money on people in emergency rooms that have little to no health insurance. Can you help us? At that time, the university said, yes, we can train health profession students to be able to screen people. So we screen for, well, you'll see it as I go on. So basically, it began in January of 2010. Traumatic brain injury was added in 2014. I basically became part of this larger screening initiative. Idaho State University, the Health Science Center is where I work. Again, it was to reduce health costs to taxpayers to a growing indigent population, people who are under 18, homeless, again, uninsured, underinsured. We also provided innovative interprofessional learning experience.
Your screen says greater than 18.
Pardon?
You said under an 18, and your screen says greater than 18.
Greater than 18, thank you. Thank you. This is just some data from last year. The number of people that we screened, approximately how many events. You can see 39% of people screened, they did not have any health insurance. 82 individuals screened likely for a TBI. You could do the math. 82 divided into 199 probably comes to somewhere between 36 and 38%. So far this year, 2018-19, we have screened 271 people. We just had an event last week that I wasn't able to attend, but I had someone fill in for me. So we screened, I know, well over 300 people this year. And again, at probably 8 events. 52% of people screened did not have health insurance this year. 61 individuals screened likely for a TBI. I mentioned that because we're the Health Professions University, so we have a pharmacy program, physician assistant, speech and language, counseling, physical therapy, occupational therapy, and all the health professions are represented. We offer a 400-level interdisciplinary elective in both the fall and spring semester for students across the health professions. We've trained since fall of 2015, we've trained 102 students and faculty across 10 healthcare disciplines that have been trained to administer the TBI screening tool. So these are future healthcare providers that are going to be out there. They are familiar with brain injury. They know how to screen for brain injury. The screenings have taken place in both southeast, southwest Idaho. We've done one screening. We have 5 Native American reservations in Idaho. We've done one screening on a Native American reservation. And I just finished in March providing training to the independent living centers up in the Panhandle area. So this, Mark Leeper with Disability Action Center and his staff, have now been trained.
So where does the screening take place? Is it when your students are in the community, like at YMCA?
Yes, so
or
typically we go to churches and we go to elementary schools. And so it's free.
But I thought it's for 18 and over, or
It is
for all
18 and older. The reason for the elementary schools is that we have some underprivileged individuals, and we've been able to give them information to bring home to their families. We do all of our screenings in collaboration with the Idaho Food Bank. We have the Idaho Food Bank as an incentive as well. That's there. I'm not going to spend a lot of time on this slide. This is just a slide that depicts the feedback from the students that have taken the interprofessional elective. And basically is, we ask some hard questions. Is this information going to change your practice? And they're sharp. They've been really objective. This is the flyer that we use. So we use both hard copy as well as electronic media. We have a big reader board that's off the interstate, and we always advertise our screenings. We use Facebook. We have Twitter accounts and all of that. So you can see the type of services that are provided. So we do a vital sign assessment, medication review, visual exam, head injury screening. We offer flu shots in the fall for free. Oral and dental health screening, tobacco use assessment, hearing loss, ringing in the ears, wax buildup, HIV and hepatitis C screening, cholesterol and blood glucose checks. In addition to, I don't know if alcohol and depression are up there, but we screen for those as well. Our counseling students administer, at the last station that we have, they do motivational interviewing. And we have PhD counseling students that are there at the events in case a person is in crisis. Those are some of the disciplines that are represented. I think there's a list of about 10, the health professions. This is basically a visual display of how a person would go through It can take 90 minutes to go through the entire screening process, to go through all of the stations. So there's check-in, you complete some initial paperwork. We have a dental station, so we have a dental clinic, and then we're training dentists as well as dental hygienists. And they do an oral health exam. We do labs, and those are done. We have a medical lab sciences department as well, and they do that in collaboration with some of the pharmacy students. Traumatic brain injury used to be a standalone station, but we have been integrated into the physical exam station now. So there's typically 4 to 6 students at every station. And it's always interdisciplinary. So we've got nursing alongside pharmacy, alongside speech and language, alongside dietetics, which is wonderful. Hearing, viral results. We have a station just on referrals, and we have some referrals that are pre-established. So we have appointments with clinics and with primary care docs that are set aside. They are time slots that are set aside for individuals that we can refer to. And then again, I mentioned the motivational interview. This is the screening tool. Yes, ma'am.
When you mentioned about motivational interviewing, it is so important to help individuals, especially who have any kind of challenge, to accept what they have and set goals for moving forward.
Yes.
Do you do any follow-up with those individuals, who come for screening, say 3 months, 6 months, or 8 months, 9 months, or a year after?
So we again, I mentioned the PhD candidate. Is there
Research
on
program.
staff. Yes, on staff at that station, at the motivational interviewing station. And then both in Pocatello as well as in Meridian, so that's eastern and southwest Idaho, we have cards that have been printed up, and the counseling program, they have a clinic that they offer, and they have clinic hours. If the person expresses an interest or a need, they are given a card, and they are seen by a master's level or PhD level counseling student at a very nominal cost. If the person does not have an ability to pay, it is free, and I've never seen it more than $20 for a counseling appointment.
But one thing is when people are trained in counseling and social work, etc., the approaches they use, cognitive behavioral therapy, something which is short-term, etc. But that doesn't work with our TBI population. So are they trained in effective strategies for helping individuals who have TBI?
Some are. Some
and
are.
That is what is the crux of
Probably not all counseling students, but there are some, because I have used the counseling department as my source of hiring graduate research assistants, and we have career path interns, or they're similar to work study students. Every student that I've had work with me under the grant has come from the counseling department. So the work that they're doing around screening, actually, they incorporate it into their classwork. But if you're asking me, do we do long-term follow-up after 9 months or a year and continue to follow that person, the answer is no. This tool was developed by Dr. John Corrigan out of Ohio State University. I believe that it's still considered the gold standard for screening. It is reliable, it is valid. It is a valid screening tool. And I will say right up front, it